one of the arms of chromosome 5 or chromosome 7. And if this is so, this patient of MDS will do well, and he may not necessarily write his will as soon as he is diagnosed. This lady had multiple myeloma, and again, as we know, lots of people of multiple myeloma would live for years together and do well. Some of them don't do well, and here is the answer. There are certain markers which are known, like chromosome 13 and chromosome 17. If you have parts of these missing, this multiple myeloma patient may not do well. So, if at all you have limitation of resources in a healthcare industry, if you put those resources on diagnostic tools, you would be optimally able to utilize your resources towards, at least direct them towards people where the outcome is slightly better. This is the Chiggy Wiggy girl, and I think she sung that Chiggy Wiggy song. This is Kai Moore, and again, last I think 3-4 years back, there is a molecule by the name of Herceptin, which is very effective in breast cancers. Around 20 to 30% breast cancers, if you take a single breast cancer cell, there is a gene out there. This is known as the Herceptin gene or HER2/neu gene, and this is a control signal, green one, and this is the HER2/neu signal. This is what a normal cell looks like. Or even in a person who has breast cancer and she does not have amplification of the Herceptin gene, it would look like this. But if there is amplification, which is shown here in the red dots, these people would do very well. This lady had Herceptin receptor positivity, and it's such a wonderful drug, Herceptin. Next, I wanted to share with you that I think in India there are around 8 to 10 transplant centers, including CMC and Tata, and now there I think Rajiv Gandhi is doing, All India Institute is doing, and a couple of more hospitals in Delhi are doing transplants, and I think we do this engraftment studies for them. This is a donor, and this is a patient. This is a male patient, and this red is an X chromosome, and this green is a Y chromosome. You can label them anyway. So if you do a transplant and take a peripheral smear from a recipient, by just counting the number of cells which are from the donor and the cells from the recipient, you can understand about the engraftment of these patients. Since we have an IVF specialist sitting here on the dais, for her interest, you also have molecular tools available. This is one of our colleagues, Dr. Ashish. He has done, I think, 7 to 8 years work on rat embryos, and he is a specialist in pre-implantation cytogenetics. And this is what in IVF lab the eggs look like. There is a 2-cell stage and a 4-cell stage, and a person like this would use a microscope, and they would be able to identify one of these cells, take it out, and use again fluorescent in situ hybridization to identify if there are certain abnormal chromosomes there, because it is known that in IVF people the probability of birth defects is very high. So if there is an IVF center, especially when we are talking about international medicine and medical tourism, if people come to India, say for IVF, they would want a pre-implantation diagnosis, and I think there are people in India who would be soon offering them. Then there are some other technologies which are there, which are again will be almost replacing the ELISAs and things like that in the coming days. So these are of use not just for testing for infectious markers, like Dr. Bhatia talked about nucleic acid testing in the morning. So these technologies would be helping us for sorting out a lot of patent issues, for also identifying minimal residual diseases and things like that. So this is a patient we had from AIMS treated for CML, and again even in fish and in cytogenetics, he was normal, but we have used a nested PCR and titrated him over a period of time, and his ABL BCR gene copies went down. But even when he was clinically okay, we could realize that the imatinib is not working very early in time, and we could shift him to dasatinib in time. So this is the advantage of using this molecular tools for appropriate diagnosis and also treating people in time. I think in the coming days, our reports will be more like this, and arrays will be in place. And maybe in the coming years, just like a credit card, all of us will carry our own FA matrix or some card, whereby information about our vulnerability of diseases will be mentioned, and physicians will not just give paracetamol to anybody who has headache. They would ask for your card, they would swipe it on a machine and tell you, I think for you, paracetamol is good, and so somebody they will say for you, ibuprofen is good. And once again, thank you very much for giving us this opportunity to be here with you. This is our team of scientists, and I'm the only odd man out. I'm a trained MBBS guy, but this is a girl who is doing fellowship with us in genetics, and these two are junior scientists, and this is Dr. Ashish. Thank you very much once again. Thank you.
Any questions from the audience? No questions? Thank you very much, Dr. Raina, for excellent talk.
Request Dr. Kansal and Dr. Munjal Mehta please come here and give a memento to Dr. Ramesh Datta.